have decided to extend the IUI camp for the month of June as well. Patients have been extremely happy and we have been able to give them good success rates, due to which we have decided to increase the time for this IUI camp. Thank you. Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Treatment options for infertility include ovulation induction, where a woman is given tablets to medications to increase egg growth and help in ovulate, egg release, and either they could try on their own or they could move on to the next procedure called IUI, intrauterine insemination, which is the second step. The third step is IVF. Well, it's not stepwise that we go, but usually when it is unexplained, we begin with an ovulation induction. Age is fine, tubes are good, sperms are of good quality, endometrium looks very good, uterus looks good in shape and size. Then we go for ovulation in the beginning with timed intercourse, and then move on to IUI, intrauterine insemination, and then IVF. So let's look at what the cost could be for each procedure. Well, ovulation induction is very economical, where the medications are very easy on the pocket. Medications are for very few days, and then when the egg is growing, the injection that is given for release of the egg and so that it can wait in the tubes for the sperms is also very easy on the pocket. So ovulation induction is a very economical procedure. Coming to IUI, yes, it's very similar to ovulation induction, but a few hormonal injections are added. So these hormonal injections could be a little expensive if they are of the extreme pure recombinant type. If they are of the urinary or highly purified variety, which is absolutely okay to be administered depending on your egg reserve and your age and your response to these medications, then the price comes down. So these injections are also given sometimes for intrauterine insemination, which is what makes IUI a little more expensive than ovulation induction. The good news with IUI is, because the eggs are not retrieved, because you're not given anesthesia, the cost comes down. All that we need to do is take your partner's sperms, purify them in the laboratory by way of sperm wash. We call it sperm wash, where the dead, the immotile, the semen, the debris from the entire the medium is removed, and only the active motile sperms are put back into the uterus. So it's a relatively easy procedure, and less consumables, disposables and solutions are used. Therefore, it is less expensive. And because it is less expensive, when it is indicated, it can be done 3 to 4 times also in women who have good patent tubes, which means they are open, the husband's sperms are good, uterus is good, so on and so forth. In IVF, the cost shoots a lot. The cost is entirely because the injections that are given for your egg growth are given for about 10 days. So it's not for a short duration, and the injections are given for 10 days. These injections are expensive because they are maintained in cold chain. They are made in extremely sterile conditions, and they have to be given for 10 days. In case you respond very well to a low dose, then the cost is low. If you respond to a dose which is very high and you are requiring to take that much to make a few eggs at least grow, then your cost also goes up. It goes to a few thousands, anywhere from about 30 to 50-60,000 rupees. It could be more also if you are taking highly purified or extremely superior recombinant injections. So it goes up even more. These injections are given for 10 days and recommended to take it from a very good place where there is a continuous power supply and they can be maintained in cold chain. Once the decision is taken to remove the eggs, which is called egg retrieval, then anesthesia is given. So it's an entirely sterile procedure which is carried out in the operation theatre. Although it is a very small procedure, you still require anesthesia. We in India, that's what we do. We give anesthesia, make you comfortable, get the eggs out. And then the bulk of the expenditure comes because of what is done in the laboratory with your eggs and your sperms. They are mixed together, or the eggs are subjected to ICSI, where the sperms are put inside the egg. So all these procedures require extremely sterile, very well examined and researched and purified products. So the products which are used are of extremely good quality. Therefore, the cost also goes up in the laboratory. These embryos that we make are cultured for about 3 to 5 days, which is why the cost also goes up by way of, when we culture them in the incubator, the gas supply, the solutions that we use, extremely sterile conditions that we use. The embryology lab itself is a high class sterile atmosphere. So these things make the procedure a little more expensive. So IUI, IVF and ovulation induction are the three infertility treatment procedures by way of ovulation induction, IUI, IVF are the three procedures, and depending on what you get done is also determining how much the cost of your treatment will be. If you want to understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.